job, Kelly, capturing a really remarkable experience that you had and bringing that story back to us. Thank you for that. Our next presentation, I'll just say real quickly, society doesn't change itself. Well-intentioned people who aren't afraid to fail or pay the consequences of swimming upriver make our society work, but it's just kind of hard to be a change maker. And some of the hardest things that I've experienced in my life have always been like trying to affect change and always be like, this is the right thing to do, stick to my guns. And ever since I met Hale, like, it's a very, very similar perspective on just value system and always just trying to do the right thing, willing to pay the price to affect positive change. So I'm just really proud to have somebody like this in the group that I do feel that connection with, that willingness to just take on shit, to be honest. Sorry to be so direct, but this is the kind of person that we need in climate change. The capstone is Nighttime-accentuated Heat Waves in California, an application of spatial epidemiology to inform policy. Hale Brown, the floor is yours.
Okay, thanks Corey, and thanks everybody for being here. My capstone is titled Nighttime-accentuated Heat Waves in California, an application of spatial epidemiology to inform policy. So I'd like to kick off with a land acknowledgement. I'd like to acknowledge that this research was taken place on the unceded lands of the Kumeyaay Nation, who have lived in and cared for the San Diego region for over 10,000 years. I offer my gratitude and honor their enduring relationship with these ancestral lands. So just to go over the agenda, today I will be starting off with setting the stage for my research, and then I took a mixed methods approach. So I'll be going through both arms of the study and then wrapping up with discussion and policy recommendations. So to jump right in, climate change is substantially intensifying extreme heat events, making them more frequent, prolonged, and severe. Heat already kills more people than any other weather-related disaster, and this is only projected to become worse over time, as shown in this figure here. Despite staggering projections, heat waves receive far less attention than other disasters in preparedness and response efforts. Also, California is especially at risk. So in the United States, California bears the highest heat-related health burden, as shown in this figure below. Its diverse climate, topography, and population make it uniquely suited to study the health impacts from heat waves. From coastal to desert and mountainous regions, microclimates and environmental injustices shape how heat affects communities. This is further compounded by stark variation in population density, socioeconomic vulnerability, and infrastructural resilience. Even within urban areas like Los Angeles, San Diego, and the Bay Area, research has found major fine-scale neighborhood-level differences in heat-related hospitalizations, highlighting the need for spatially refined analyses and localized adaptation. In California, we generally see two main types of summer heat waves: daytime-accentuated heat waves, where high daytime temperatures are followed by cooler nights and allow for some overnight relief, and nighttime-accentuated heat waves, where high temperatures persist well into the night with little cooling, and the one I'll be focusing on. This balance is also shifting. So climate change is driving faster increases in nighttime temperatures than daytime extremes, disrupting the state's historically semi-arid Mediterranean climate of hot days and cool nights. Along the Southern California coast specifically, emerging patterns point to rising humid nighttime heat waves, influenced by ocean warming and higher atmospheric moisture. This shift poses a growing threat to public health. Cooler nights are essential for thermoregulation, allowing the body to recover from daytime heat. Without this relief, physiological strain builds, especially among vulnerable populations. Also, while officials have voiced concern about the health risks from nighttime-accentuated heat waves, empirical evidence in California remains limited. And most heat action plans, early warning systems, cooling centers, and labor protections are all focused almost entirely on daytime accentuated heat. So nighttime accentuated heat waves and its cumulative strain is rarely addressed. So where are the policies for overnight heat and protection? Environmental justice is essential in addressing this question. While everyone is vulnerable, the burden falls disproportionately on marginalized and low-income communities. Across the state and in San Diego, as illustrated in this example, historically redline neighborhoods now face lower healthy places index scores, reflecting decades of disinvestment in housing, infrastructure, and green space. These areas are especially vulnerable to nighttime accentuated heat. Older buildings, low tree canopy, and limited AC access prevent indoor cooling and compound health risks when recovery is most crucial. Yet many policies overlook these disparities, omitting nighttime temperatures and failing to prioritize vulnerable neighborhoods. Without fine-scale data and equity-focused planning, those most at risk will continue to bear the brunt of worsening health impacts. As Eric Kleinenberg said, heat waves are silent and invisible killers of silenced and invisible people, a reminder that the toll on human health is preventable and often ignored. So the objective of my project was to assess the spatial distribution of health impacts from nighttime accentuated heat across California and identify actionable policy-relevant strategies for adaptation and public health response. A mixed methods approach was employed, combining a quantitative arm that mapped where nighttime accentuated heat has the greatest health impact, and a qualitative arm that involved stakeholder interviews on heat policy and infrastructure informed by the quantitative arm. So to jump into the quantitative piece, the analysis built on recent work using high-resolution data from the warm season of 2004 to 2013 over about 1,500 California zip codes. Each day was classified as a heat wave or not across 36 definitions and based on temperature metrics like duration and extremity. We focused on daily hospitalization data for cardiovascular, respiratory, renal, dehydration, and heat illnesses, and aggregated this at the zip code level. Zip codes most affected were those where minimum temperature or nighttime accentuated heat waves led to the highest number of hospitalizations. So the final output was the total number of zip codes with the highest health burden from nighttime accentuated heat waves. We also examined community characteristics, so specifically 30 environmental justice related metrics previously linked to increased vulnerability to extreme heat in California. Data sources included the 2010 Census, American Community Survey, and Healthy Places Index. For the analysis strategy, we mapped and examined nighttime accentuated heat wave spatial heterogeneity, as well as highlighted where community characteristics such as income, age, and housing conditions are most strongly associated with severe nighttime heat risk. Logistic regression models were then utilized as well to assess how these characteristics are linked to extreme heat across California and its climate regions, and to improve comparability across these community characteristics, all metrics were standardized. So big finding here, we identified zip codes where minimum temperature or nighttime accentuated heat waves led to the highest number of heat-related hospitalizations during the study period, shown in red here. Across the state, substantial spatial heterogeneity can be noted, and these impacts are geographically scattered with a slight hotspot in Imperial County. Compared to other heat wave types, like daytime accentuated extremes, the fact that roughly 20% of zip codes, 22, show minimum temperature extreme heat as the most harmful highlights the significant health burden of nighttime accentuated heat and how these events should not be overlooked in planning and response. We also then analyzed communities within California's 6 major climate regions to capture localized patterns of vulnerability. And as shown on the legend, the southern deserts and the coastal regions, particularly the coastal south, had the highest proportion of zip codes where minimum accentuated heat waves were the most impactful. For each region, the top 3 associated community characteristics are color-coded, and this refined analysis showed that demographic variables like age and sex were consistent predictors of vulnerability, alongside socioeconomic and built environment characteristics like lower educational attainment, more impervious surfaces, and limited tree canopy. We also found that different marginalized groups were disproportionately affected depending on the region and reflecting how the intersection of race, income, and infrastructure shape vulnerability. Notably, the most impacted zip code in the coastal north in that green had higher proportions of residents without air conditioning. In many coastal areas, AC is less common due to that typical marine breeze, highlighting how these communities may be unprepared for rising nighttime temperatures. Overall, susceptibility to nighttime accentuated heat waves varied by climate zone, emphasizing the need for localized, community-specific adaptation strategies. So while the maps and models reveal where the health burden of nighttime accentuated heat is most severe, spatial patterns were diffuse and relatively evenly distributed across the state. In seeking to better understand if institutions are aware of this and how they're responding, the next phase of my study drew on stakeholder interviews to examine the policy, governance, and equity dimensions of nighttime heat resilience. So I held 10 interviews with 14 individuals or stakeholders across state and county governance and non-governmental organizations, from local level implementers to global heat resilience campaigns. You'll see my stakeholders there in the bottom. In the solid outline, you'll find the state level stakeholders. Dashed outline are my county level stakeholders, and the NGOs you'll see in dotted outlines. These conversations explored how nighttime heat is understood and addressed in practice, the current gaps in policy and infrastructure, and the opportunities to refine early warning systems, heat action plans, and interventions to better protect high-risk communities. Overall, 226 quotes were coded by 2 independent coders. 16 unique codes were identified and collapsed into 5 key themes, which were organized by 1, cooling strategies and infrastructure, 2, communication and public awareness, 3, data and evidence gaps, 4, governance and policy action, and 5, equity and vulnerability. Themes reflected differences by institutional role, geographic scope, or the proximity to frontline communities that the interviewees held. I'd like to pull out just a couple here. So in the cooling strategies theme, we saw a state-level stakeholder say, quote, "Maybe it would just be better to just provide air conditioners and some kind of utility plan that encourages them to use it, not fearing that they might go broke if they run the air conditioning to save their lives." And then another one from another state-level stakeholder in the governance and policy action, we heard, quote, "But then oftentimes planning dollars are not attached to implementation dollars. And so then communities will make this plan, and by the time that there's implementation dollars available, their plan might be out of date. And so the funding mechanisms around adaptation strategies and interventions, there's a lag between the planning period and the ability to implement or act upon those plans." Okay, so to bring those 2 arms together, this mixed method study identified nighttime accentuated heat as an under-recognized yet increasingly critical public health threat in California. Quantitative analysis revealed that elevated nighttime temperatures impose a geographically uneven burden of heat-related hospitalizations, and these patterns complicate a one-size-fits-all approach and underscore the need for tailored adaptation strategies. To understand barriers to policy implementation, we conducted interviews across state, county, and NGO levels, and participants consistently noted that extreme heat policies and infrastructure fail to account for nighttime conditions, despite clear physiological risks associated with insufficient overnight cooling. Cooling centers, for instance, are rarely open past 5 p.m. and often inaccessible to those most vulnerable. You'll see a quote there targeting this. And some promising policy and innovations were emerging, however. So for example, the LA County Department of Public Health is developing an ordinance to establish maximum indoor temperature thresholds for rental housing. Proposals for subsidized HVAC and air conditioning installation, along with other utility supports, reflect growing recognition of the urgency around heat exposure. At the same time, stakeholders pointed to persistent challenges: fragmented governance, limited and unstable funding, and gaps in data systems, especially when it comes to capturing environmental justice indicators at fine spatial scales. There are best practices to learn from. However, models like the Montreal Heat Response Plan demonstrate how cross-sector coordination and equity-centered planning can improve outcomes. Taken together, these findings suggest that addressing nighttime heat effectively will require institutional reform, sustained investment, and region-specific strategies grounded in community knowledge and equity. So overall, by combining fine-scale analysis with stakeholder insight, this research demonstrated that the impacts of nighttime accentuated heat waves are spatially dispersed and reveals why existing systems often fail to respond adequately to this uneven and evolving threat. In calibrating heat adaptation for warming nights, a few things are necessary. One would be recognizing nighttime-accentuated heat as a distinct hazard. So nighttime temperatures are rising faster than daytime and yet remain invisible in most policies, alerts, and interventions. Public health systems must adapt to reflect this evolving risk. Also, centering equity in adaptation planning. The communities most exposed, those historically redlined, under-resourced, and lacking cooling infrastructure, must be prioritized. This will require moving beyond universal interventions to developing policies that explicitly prioritize communities with the greatest exposure and the least adaptive capacity. Without such a focus, existing disparities are likely to be reinforced as extreme heat intensifies under climate change. Also, advancing neighborhood-level research. Fine-scale, justice-oriented data is critical to identify who is most at risk and where. We need more empirical work linking exposure, health outcomes, and structural vulnerabilities. And finally, building coordinated cross-sector systems. Fragmented governance and ad hoc funding delay life-saving interventions. California must fully institutionalize heat as a disaster risk and fund integrated, equity-centered response systems. I'd like to close with some gratitude. I'm grateful to my capstone committee, Dr. Tariq Ben-Marnia and Dr. Sasha Gershonov, for their expertise in California heat waves, environmental justice, and epidemiological methods. And my deepest thanks goes to Dr. Anais Tayton, whose mentorship and study support were truly instrumental in shaping this project. I'm proud of what we accomplished together. Thank you to the stakeholders who generously shared their perspectives during this research, and to Jay Mazel for the use of his photographs. I'm also grateful to the Julia R. Brown Fund for supporting my travel in a few days to the UNFCCC SB 62, where I look forward to sharing these policy insights and engaging in dialogue with international peers about the challenges and opportunities of addressing nighttime heat in diverse policy and climate contexts. Through these conversations, I hope to contribute to a more inclusive, equity-focused, and evidence-informed approach to extreme heat adaptation. Thank you.
Hi, Hale. That was amazing. So during my research, I found this company that produces window heat pumps, and they reduce electricity, and they basically act as air conditioners, but they're not as ugly. And they were used in a case study in Fresno to see how that they help residents that can't necessarily afford air conditioning. And if you could give this information to that stakeholder who said everyone should get air conditioning, it reduces costs by, I want to say, 80%. And yeah, that's a bad response to giving people air conditioning and not letting them have the money to pay for it. So this could be one solution that might help up there.
Okay, that's super cool, Liv. I definitely would love to get that paper from you so we can see how I might be able to integrate it into my paper, maybe.
I was just wondering, what patterns you observed of, perhaps, locations that were most affected, the types of people present in those areas, what patterns have you observed? And also, have you seen any efforts being taken on the city or state level anywhere to address this kind of issue, or is it kind of off everyone's radar still?
So going with your first question or second question, there is rising awareness, and I think public officials are aware of this and communities are aware of it, and yet I think the adaptation to it is pretty delayed in terms of taking actual concrete actions towards addressing this in policy and other heat adaptation. And your other question, the spread in terms of finding patterns across the state of California was so spatially heterogeneous that we kept digging further to try and find patterns, and I think the biggest pattern we found was just how spread out this impact is of the health impacts from these nighttime heat waves. We did see higher concentrations of those impacts on the coast, as we might expect. but it is such a spread, and I think just really pulls on that public health lens of how much attention is needed on this issue.